Okay, good morning, everybody. This morning's topic is using impact training in concussion management, and we have Viviane Ugalde with us. Viviane is the medical director for concussion management at the Center in Bend, and is also a foundation board member. She also serves on the Oregon Concussion Management team known as OCAMP as our liaison for Central Oregon. And she also runs a concussion clinic that coordinates care for the Central and Eastern Oregon area. So on that note, Viviane, I'm going to hand that over to you. Thank you so much for doing this for us this morning. We greatly appreciate your time.
Sure, no problem. Good morning, everyone. And hopefully all of you can hear me and see the screen well. I do want to do a little disclaimer here. I am not a neuropsychologist, and I rely heavily on Sandra Marshall, who is one of our neuropsychologists in the community, who came to Bend actually recruited to help implement the ImPACT testing in our community. So I will go through more of a clinician's view of how to interpret the testing, and just know that if there's anything that puzzles me on a test, I rely heavily on Sandra and our other neuropsychologists in the community to help with the interpretation. For some reason, my slides aren't advancing, Melissa. Let me see if I can escape.
You can go ahead and restart them. Can you use the arrow on your keyboard to advance them?
Yeah, no, nothing is advancing it. So,
Do you want to close them out and restart?
Yeah, I'm trying to escape, and that's not working either.
Yeah, it throws up on you. Here, let me see if I can stop sharing your screen, and I'll change it back to me for a second. Let's see if
okay.
For a sec. Pull them back up, and then we'll try it again.
Can you still see me, Melissa?
I am going to reshare the screen with you. Thank you, everybody, for your patience. Okay, Viviane, you should just say okay again to sharing your screen.
Okay, I'm just going to.
There we go.
Now it's not working again.
That's frustrating.
Yeah.
Well, I think everybody has your slides. So we can probably let people pull them up, I would think, while you would talk.
Yeah, I don't know what I'm doing wrong here.
I can pull them up, and then I can advance them, I think. Let me pull them up.
All right. I just have to actually. Can you still see what's happening on my screen, or no?
I can.
Okay. Well, I'm wondering, I'm going to try this one more time as a
Does it advance that way?
A slideshow and just see if it'll let me there. Okay, so you can see what's happening on my screen now?
Yes.
Okay, all right. Well, I'll just keep going then. So one of the things that the ImPACT test was originally designed for was to say, hey, we don't really have a good way of assessing if an athlete's cognitive function is different after a head injury. And there's such a wide range of cognitive functioning in people that if you gave them a test after the injury, you wouldn't know if that was really a decline or if they were the same. So this thought was that maybe we could design some sort of simple, more refined neuropsychological testing to have a picture of what that cognitive testing and function was like before any head injury, to allow a comparison after a head injury and get a sense of if there was any true and significant cognitive deficit related to the head trauma. Typical neuropsychological testing takes about 4 to 6 hours. It's pretty intensive, and it's testing various functions of the brain in a wide range. So it's still our gold standard for helping us to diagnose cognitive changes in a person with head trauma. However, that's not really practical to apply to a large group of people, athletes. And so the ImPACT test is just one of many neurocognitive tests that are available. It's one that's, I think, been around probably the longest and has had the most study. So we use that in Central Oregon as a mandatory baseline test for the high-risk sports. So football, girls and boys soccer, girls and boys basketball, and wrestling. And then some of the club sports have actually signed on to do it. I know that like MBSEF up at Mount Bachelor, they have their ski racers do ImPACT baseline testing. I think some of the lacrosse teams have occasionally gotten together and suggested that, but there's not a huge consistency in that. We do offer baseline testing, and I just put for a fee there. It initially started out as $10, and I think it might be $20 now. I'm not 100% sure. We do it at the center here in Bend, and Desert Bone and Joint Orthopedics does that as well. So there's a couple of clinics in Bend that offer baseline testing. And it really is just a segment of neurocognitive testing. So it's looking at memory, reaction time, and the ability to do some new learning. So it doesn't study everything that a full-blown neuropsychological test would do in a neuropsychologist's office. The ImPACT was originally designed for children from ages 12 and up, and then it has norms all the way through to age 59. So in my clinic, I will use the ImPACT for adults as well, like in car accidents and that sort of thing. But specifically for kids, it's designed to be for ages 12 or above. There's some controversy as to how good of a test it is, particularly for baseline testing for children under the ages of 14. So there's actually now a new pediatric ImPACT test for ages 5 to 11. We do have it in our clinic, and we've just started using it. And it's a slightly different formatted test. It's formatted to be done on an iPad with a touch screen. So it's a little bit different than the traditional ImPACT test. There's lots of controversies about using ImPACT. You may have heard about sandbagging. So some athletes who don't want to be pulled from their sport might purposefully do poor on the baseline test so that if they do get a concussion, it doesn't look too different from their baseline. There are some things that you can do to look for that, and we'll talk about that in a few minutes. Sometimes there's a learning effect if you do too many of these tests, and there's been some criticism about kids learning how to do better and better, and so again, not being a true valid picture of what their cognitive function is. Sometimes you can have effects on performance, particularly again if you're comparing a baseline to something post-injury. So if the testing conditions are different from time 1 to time 2, that may have some effects on it. So if the kids really took their baseline immediately after daily doubles and they're exhausted and they had less than 7 hours of sleep, that may also affect their baseline test. and make it a little bit more difficult to compare the two conditions. We do baseline testing in the computer labs at the schools with our athletic trainers, and we try to keep it below 20 kids at a time, but even that has been more recently criticized, that you should only have like 5 to 6 athletes and students taking these tests at one time. So again, there are some issues about that, and you should be aware of that. There are some papers that have looked at the sensitivity and specificity of diagnosing a concussion, and you can see there that there's some reasonable sensitivity and specificity of the test. And the reliability of the test retest was fairly poor if you took it from like just within a day or two of each other. But if you had longer intervals of several weeks, then the test retest reliability was better. So we have to be aware of the limitations when we're using these tests, just like any test that we order on a patient. We have to know what it's really testing and what its limitations are, so that we can interpret that appropriately when making clinical decisions. The ImPACT is continuing to evolve. They have a thing called reliable change, which is basically looking at the statistical standard deviation between comparing two tests. And so, for instance, if you look at a composite score on baseline compared to post-injury, if there's a greater than 1 standard deviation decrease in that function, then it's highlighted in red on the test, and it's called, there's a reliable change, in indicating that that is statistically significant change. Certainly when you use the ImPACT, it should be just a part of your assessment of the concussion management, and it shouldn't be used as a standalone test to say, oh, okay, you're cleared from your concussion, it's okay for you to go back to play, because you can run into some difficulties with that, and we'll talk about that. It was also in the past hard to share this information, but ImPACT has made it easier with a passport number that you can now look up tests across the state if the athlete is moving or just is going from clinic to clinic. One of the things that we use in my clinic as an initial assessment is the SCAT-5, and all of our athletic trainers use this as well at the schools. And so I put this up here just to make you aware of it if you haven't seen it before. And I apologize for how small it is, but you can see that the reference to the British Journal of Sports Medicine is up there, so you can just Google it, adult SCAT-5 and child SCAT-5. The part that I use in the clinic is on the right-hand side of the screen, where it's the office or off-field assessment. The left side is what the athletic trainers will use on field, and some of those are some good questions, like the Maddox questions on the far left bottom there of that left-sided sheet, where you're asking the athlete at the time of the injury some basic questions like what play were you in, what quarter, what half, where are we, some basic orientation questions that could be helpful. And it also includes the red flags for the athlete's parents or supervisors to keep an eye out for more acute injuries. There's also a cognitive and neurological screen that's included in this, and you can do repetitive tests with this if the person is coming back into your clinic to do some comparisons on improvement. I should just go back one slide here. On the step 2 on the far right there, the symptom evaluation, that's really a key component of your assessment, because symptoms really trump any kind of neuropsychological testing. And if a person remains symptomatic, then you should really do some more in-depth evaluation before considering releasing them to play. And then I just have here the SCAT-5, which is for ages 5 to 12. And the assessment is just a little bit different. Particularly, they have a child and a parent report of symptoms, which can be helpful. And then the neurological testing and screening is just slightly different. For instance, on the concentration piece, instead of asking the months of the year in reverse order, you'll ask for the days of the week in reverse order. So it's just a simplified version of that neurological testing and screening. A part of the assessment for concussion would be a balance test, and this is showing you the balance error scoring system, or the BESS test. And this is a really good test for looking at a balance, cerebellar function, vestibulo-ocular function, at least initially. It's there's some other testing that we'll do as well for that, for the visual piece, but there's 3 positions. You do them on the firm floor and then on a Eric's foam mat with eyes closed, holding that position for 20 seconds and then looking at losses of balance or change in posture greater than 30 degrees off the midline. And you can get a score with this testing as well. So this is a component of our assessment beyond the ImPACT and the SCAT-5 that we do to help determine if the athlete is recovered. We used to do an immediate ImPACT test right after the athlete was injured or within 72 hours. And we found that that wasn't really necessary. Usually it's pretty evident that the athlete has a concussion. And so you're just putting them through a test that's going to make their symptoms worse, particularly headaches, that sort of thing. And so we don't do this routinely anymore. The time that we would do an immediate ImPACT test after an injury is if there was some question, is this really a concussion or not? And so we would test at that time to give us some additional information in terms of their cognitive functioning to help us with the diagnosis. But as I said, we typically don't do this immediately, and we'll just give the athlete and parents recommendations for resting, and then give them some accommodations for their school, so they would know when to return to school and what kind of changes might be needed to help them manage their symptoms while they're returning to school. After an athlete is injured and it has been recovering, we use the ImPACT test as a component to determine if the athlete is ready to return to play. And so the athlete first and foremost has to be symptom-free. And so we'll use that symptom checklist to assess them as they come back into the clinic. If their symptoms are relatively low and they say they're back at their baseline, then we'll consider doing the ImPACT test at that time. You should know that with these symptom checklists, it's fairly common for athletes or students or children to have some symptoms. So you don't have to necessarily have a score of 0. And I believe the average is 4 to 8 symptoms for men and 8 for men and 11 to 12 for women in terms of an average baseline symptom score. So basically the athlete is symptom-free or back to their baseline of symptoms. Sometimes you have children with headaches even before the concussion, so that may be an area where they might have some symptoms. So they're symptom-free. Their balance testing is back into a normal range. And then we also ask them about school performance and make sure that they are performing at their baseline. They're not requiring any accommodations. And it's at that point then we'll repeat the ImPACT testing if they've had a baseline, or do the ImPACT test for the first time. Now we get into the meat and potatoes of this, and that is, how do we interpret a test once we've gotten one? So one of the things that we can look at is just a quick check of the percentile scores. So for instance, if we are reviewing a baseline test, none of the scores should be less than 1%. That would be somebody who's profoundly cognitively impaired, and so you wouldn't expect that. There's also a built-in validity score called the impulse control composite score, and that score should be less than 25. And just in general, if you're looking at a post-injury test, I always ask for the student's academic performance. I usually ask the question, you know, what kind of a student are you? Are you straight A's, A's and B's, an average student of C's, that sort of thing? And then they'll typically tell me how they do. We can ask them what kind of a performance they've done on their Smarter Balance tests, or like SAT, ACT test, that sort of thing. So you can kind of get a sense for where the student's performing academically. Have they been taking any advanced placement or IB classes, that sort of thing. And so you can get a sense from that academic history about where they should be performing percentile if they were performing at their normal cognitive level. So you can see those percentages there on the screen. There's also some raw scores that a typical C student should get if you're looking at those individual composite scores. Excuse me, not the composite scores, but the raw scores within the test itself. And I'll have a screen with an actual test so you can get a sense for where these are coming from. So unexpected scores would be on baseline testing if you had some areas where they were less than 1%. And sometimes it's not that the student was just not caring and trying to sandbag or that sort of thing. It might be that they misinterpreted the directions of the test. So for instance, in the visual motor speed composite, if that's less than 1%, you can ask the test taker if on the X's and O's portion of it, there's a distractor where they're supposed to click the numbers backwards from 25 down to 1, and they're all scattered across the paper. So if the person wasn't paying attention and they started counting from 1 up, then they would get a score of 0 in that area. So you could look specifically to the score in the 3 letters for average counted correctly. If it was 0, then you know that they weren't following the directions properly. You may have an unidentified learning disability or ADHD that's popping up if you have a less than 1% score in a category. And then if a kid says that they're taking AP classes and they're scoring, in the 5th percentile on memory, then you've got to wonder what's going on there. So particularly with baseline, that would be something to check into. When you have a test, it'll come up with a composite score with raw and percentile scores, and this is really the page that you're going to be looking at the most when you're interpreting scores. And so the composite scores are listed in that order. You'll see the memory composite, verbal memory, and so forth on down the line. It's important to know that these composite scores are combinations of different sections of the test. For instance, verbal memory is the total percentage correct on word memory, plus the total percentage correct on the hidden symbol match, plus the 3 letters correct, and then you take that total number, divide it by 3, and that's your score. So you can see that it's pulling from different components of the test. For instance, reaction time is the X's and O's average correct reaction time with interference, plus the symbol match average correct reaction time visible divided by 3, plus the color match average correct reaction time, and that taking that total number and divided by 3. So you all don't have to really remember all of those specifics. It's just important to know that these composite scores are from a combination of the test. And I would recommend highly, if you have a chance to sit down and take the test yourself, that you get a sense of what it's testing, and you'll understand the components of the test a little bit better. And you'll see, I just took the test recently, and we'll interpret my results. They'll come up on the screen. I don't know if you'll be able to see them very, very well. I'm a little bit disappointed with the slide, but we'll go into that. So if you have a baseline, you're going to look and compare the baseline scores to the post-injury scores, and you're going to look for anything highlighted in red, which again means that there's that reliable change index. That's the standard deviation decrease in function. If you have two areas that are highlighted red with that reliable change, then the person would be considered still be performing cognitively poorer than prior to the injury and is still recovering. If you don't have a baseline, then you won't have any highlighted red reliable change because there's nothing to compare to. And then that's where you're going to be, hopefully your folks that are pulling up those reports will click on the box that says compare to age matched norms. And when that's the case, then you'll get a percentile score. Otherwise, you'll just have raw scores that'll show up on your test results. So make sure you click the box for the age matched norms, and then look to see if the student is performing at an expected percentile based on what they say their academic performance is. So here's my test, and so I just want to show you what a report looks like. I took this a couple of weeks ago when I was preparing for this lecture. And so you can see there's some baseline information there. It talks about the education levels. It asks if the person's had any prior concussions, because that can be important. We know that people with multiple concussions will often take longer to recover than people that have never had one before. It asks questions about if the person's ever been diagnosed with ADHD, dyslexia, autism, if they've had any strenuous exercise. And then the next page goes into the composite scores. So this is the meat and potatoes of what you're going to be looking at. And I didn't have a previous baseline, so this would be considered my baseline test. And you can see the verbal composite there, the raw score was 99, and compared to my age matched norms, that's in the 100th percentile. So I did pretty good with the verbal memory composite. So that means that when I look at words, I'm remembering those words very well. Now you can see on the second line, the memory composite visual there, my score was only 52, and I'm sorry, the percentiles aren't looking very good, but I think that was the 26th percentile. What that's doing is showing the tester different shapes that are fairly complicated, and they're oriented in different ways. They're asking you to memorize what those look like and in what direction they're pointing, and then with a distractor, they'll come back and ask you if you've seen that shape before. So obviously my visual spatial function isn't quite as high as the verbal memory. And then the visual motor speed composite and the reaction time composite are looking at my reaction times and my speed of processing information. And so, you know, both of those are scoring within a reasonable range of normal. One of the things that I want to highlight here is that you can see on this reaction time composite that my percentile was, I believe, the 38th percentile. And one of the things that can really affect reaction time is when you do the symbol match test. And the symbol match test is basically lining up a number with a different symbol, and then there's portions of the test then that will take away the numbers, and you have to remember what symbol was matched with which number. Part of that test is that it's measuring how quickly you are responding to those different matchups. And if you are unaware, and of course I was a little bit sleep deprived, you can see I only slept 6 hours, and it was disrupted sleep at that before I took this test, that I wasn't paying as close enough attention to when that timing of that test came on. So I think that artificially lowered that reaction time composite for me. And you can see that fairly frequently. So when you are giving the student directions on how to take the test, you want to make sure that you're cueing them to pay attention, read the directions twice, and make sure that you're following all the directions exactly as written. and moving through the test with as much speed as you can, so that you can get a more accurate and appropriate test of cognitive functioning. If you look at that impulse control composite score, that's the score that I was telling you about, that gives an indication as to whether or not the person taking the test was giving a true effort. So if their scores are getting up into the 20, definitely above 25 range, it's really not considered a valid test, because the person was probably just clicking through things randomly and wasn't giving a good effort. The total symptom score, you can see, is the total symptoms that I recorded. I think I said I was fatigued and tired because I was up late working. And then the cognitive efficiency index is something that is specific to the symbol match test. And again, that's looking at if the person was going really slow to try to be really accurate, or if they were kind of speeding through it, maybe trying to be as faster than they could be accurate. So that's the test results. Now you can, and I apologize for this, you're probably not going to be able to see this very well, but this is now going beyond the composite. And if you want to dial down into just more information into the test itself, it's giving you the raw test results for the different sections of the test. So word memory is just flashing up words and with distractors, and then you have to click on the ones that were actually shown to you. Design memory are those funky shapes that I was telling you about. And then X's and O's is an interesting portion of the test, because it flashes up X's and O's almost like a tic-tac-toe, but much more complicated grid with numbers around there. And you're supposed to remember where you saw the X's and O's on the screen with a distractor then in between, where you're counting down from 25 and you're having to click as fast as you can, finding the numbers that are scattered around the page, then coming back and saying where those X's and O's are. So again, a memory and a visual spatial test. The symbol matching is the section of the test that matches up numbers 1 through 9 with just random symbols, and you practice a couple of times, and then you have to remember what number goes with what symbol. Color matching is an interesting one, because they'll flash up the word blue, but it might be colored in a green color, and you only are supposed to click on the words that match with their true color. So again, it's an attention test, and it's looking at that ability with the reaction time to click on an appropriate one. And then 3 letters are just 3 random letters in a sequence. I apologize. Not well, on the X's and O's, that's different than the counting down back from 25. That's with the 3 letters. I apologize. So the 3 letters is where they put the 3 letters in an order. You have to remember them, and then distract you with counting down from 25 down to 1. So that's the test and the raw scores themselves. And again, I will only look at this if I have an unexpected composite score. And then here's the symptoms score portion of the test, and then they just graph it out so you can do a graph comparison. So now we have a composite, excuse me, now we have an athlete's test that we're looking at here. And I have the composite scores up. So you can see on the left there, the top baseline testing was performed in December of 2010. And then you have the composite scores with the raw scores there, as well as the percentile scores to the age-matched norm. The next column is a post-injury test. So this was after their concussion. And I think at this time in our protocol, we were still doing immediate post-injury testing. So you can see here on 2/14/2011, the athletes suffered a concussion, and within 72 hours, this was their test result. And then we have two subsequent post-injury 2 and post-injury 3 tests after the concussion to see what happens with those scores. You can see the verbal memory composite score never really changed throughout the testing. And in fact, probably from a learning effect, the athlete did have some improvement in their verbal memory composite scores by the time they took the test for the 4th time. The visual memory composite went from an 81st percentile down to a 34th percentile, and their raw score was considered statistically significant. So that reliable change index is highlighted in red to show that that score of 86 on the visual memory composite dropping down to a 67 is statistically significant. The visual motor composite went from 11th percentile to 3rd percentile, but was not considered statistically significant. And then you can see the reaction time composite actually had some improvement. And again, maybe the athlete understood the test taking a little bit better. Who knows? There's some variation that can happen just from test to test. And so that's why the reliable change index is important to consider. You can see that they were still having some problems with their visual memory composite by just a little over a week after their first concussion. And so the athlete was presumably held out from competition until they cleared on March 14th, 2011, when their scores were back into the range consistent with their previous baseline testing. You can see that they have some hours slept at night, appropriately recorded for the baseline and for post-injury 2, but ideally you'd like to see that recorded for all of the tests so that you can help in making that interpretation. If you want to learn more, ImPACT does have some free concussion training courses that are pretty basic, and then I think they're like $40 or something like that for more in-depth training. And you know, that may be worth it if you want to feel more comfortable. Obviously, this is just a kind of a generalized brush of how you could look at these tests and start to interpret them. One of the things that I did want to say was that when we have people coming into the clinic, and if you look at their symptom checklist, either on the SCAT 5 or if you're only doing the ImPACT, and you see that like nervousness, anxiety, sadness scores are elevated, I'll also have them fill out a PHQ-9, the Patient Health Questionnaire 9, and you can Google that and print that up, and they have an interpretation of that as well. And that I think is very helpful for looking at the affective symptoms in more detail. You don't want to miss a kid who's starting to feel a lot more depressed. Kids without any history of depression or anxiety can have significant symptoms after a concussion. And sometimes they're just maybe not aware of those symptoms, or they're maybe too embarrassed to talk about it. So the PHQ-9 I find is a useful tool to tease out those symptoms. And then the last question on the questionnaire asks about self-harm. Are they having any thoughts of harming themselves? And again, that's really useful to identify those kids early to get them into counseling. So that's kind of a quick, breezy review of the ImPACT testing. I want to emphasize that when we look at these test results, we are looking at them within the context of the whole individual. And so we know about their academic history. We have an idea of what medications they're taking, if they're on any antidepressants or anticonvulsants that may affect their test results. We know about their balance. We ask about their academic performance. And we are interpreting those test results within the context of all of that information, and making a decision as to whether or not the athlete is improving enough to the point where we feel that they could return to some competitive activity. The other thing I will say is that we do encourage people to stay as active as possible, and not to just stay in a dark room, because we know that recovery is dependent on people returning to their activities and routines as quickly as possible. People who stay in dark rooms have a much longer recovery than people who try to return to their normal activities as soon as possible. And again, that's symptom dependent. And if people are struggling, that's where the concussion clinic comes in handy, because we try to interface with those students and athletes and patients to figure out ways to manage their symptoms so that they can return to their activities as soon as possible. So I'm going to open this up for questions, because I'm sure some of this stuff is as clear as mud.
So far in the chat, we don't have any questions. If anyone has any, now's your chance.
I think Agnes just flashed up a question about what are the minimal qualifications for a person to interpret impact testing.
Just saw that one.
Yeah, so I think that's a really good question. And I think, anybody can look at this test and see the red and say, oh, that looks abnormal. But I think that I would definitely take some of those basic courses that are for free. I would definitely take the test so you get a sense of what your patient is doing on the test. You get a better understanding of it. And I think that if you had a neuropsychologist that you could bounce several of these tests off to get an idea of if you're recording them appropriately or interpreting them appropriately, that would be helpful in your learning process. I don't think there's any specific qualification for interpreting these tests, and I think that's one of our concerns when OSAA encouraged implementation of using the impact across the state. There wasn't necessarily we knew that there weren't necessarily going to be neuropsychologists in every community to help folks. One of the things that OSAA put forward is that there's Mick Keister in Eugene, and there's Jim Chestnut in Portland at OHSU, and there's myself who are available to help if you have questions about that, because we wanted to kind of split the state up into regions and have experts available. So that was a really long-winded answer to your question. So there's no perfect or specific qualification. And I would definitely rely on other experts if you're just starting to use this in your practice.
So the next question is, where can they get a copy of the test to take themselves?
If you have, well, let me see now. I was going to say, if OSAA is using them in your community, you can probably contact the school and just say, hey, I'm one of the clinicians that's going to be helping with this. Can I come and take it? There's usually a link that you can perhaps even take it online in your own office, but you'd have to work that out with the folks that are using it in your community. Are there any other questions?
Emma had to go, so she left and says thank you.
Awesome.
I don't see any other questions, but there's lots of ways to get questions answered should they come up in the future. If you send Siebert a question of any kind, you can send it to myself. I'll put it in the chat, but I'm McCart Melissa, or McCart at uoregon.edu. I'll put that in the chat, you can always send me an email, and if we don't have the answer to your question at CBERT, we will forward that on to Vivian or Mick or Jim and get you an answer to that question. We also have a staffed librarian at CBERT who can look up and find you just about any research you're looking for to support whatever you're doing around concussion management. That's available. We're here to help. We do a lot with the schools in terms of concussion management teams and whatnot, so we can support you in that. And we will get answers to you. Vivian, we have one more question. It says, I find the arrow part, the visual composite, very difficult and wish they would update the test in better patterns. I guess that is a comment more than a question, but do you have anything to respond to that with?
So what is the question? I missed that first part.
Comment saying that the visual composite is difficult and wish they would update the test with better patterns.
Oh, I would have to agree, since I just took that. That was very challenging. I don't know, we'd have to ask our colleagues in the ImPACT company if they are having any plans to do that. Is anybody on the call that is a neuropsychologist? Because they might.
I don't know. I don't recognize a name.
Okay.
If anybody is, let us know.
Yeah, because there's lots of different ways to test visual, spatial, and design memory. And I know that there's some other types of tests that will look at more traditional shapes. But I think the challenge is to look at something unique that you don't have any maybe learned or stored memory of, which makes it obviously easier to remember if you can relate that shape to something. So I think it is a truer assessment of basically visual spatial memory.
Okay. Well, I guess on that note, we will end. Like I said, if you have any questions that come up later, please send them our way, and we'll do our best to get anything answered for you. Have a great day, and thanks for joining us.
Thank you, everyone.